Hello, Dr. Jignasa. Lovely to have you here today.
Call me Jigs.
Oh, I would love to. I mean, I've only met you 3 days, but I feel like I've known you for a very long time.
Oh, and likewise, it's been such a pleasure being here. Really is. Everyone's been so lovely, warm, and welcoming.
Oh, thank you for coming to Abu Dhabi first. Thank you for supporting our profession, our orthoptic profession, being here in the Emirates Society of Ophthalmology conference. It's really nice to have you here, and you've really shown us the support that we needed in this region. And it's been wonderful, wonderful for you to share your experiences. So, on the topic of experiences, can you tell us how you got here today?
Of course.
Not by plane.
Yes, via my brother, who actually lives here, which is great. So how did I end up in orthoptics, do you mean? Yeah, so I knew when I was younger that I wanted to work in the medical field.
Okay.
Wasn't sure if I wanted to do medicine, but I knew that I wanted to work with children. Funny enough, so I was like, really wanted like something to do with pediatrics.
Yeah.
So I explored all the various options and actually stumbled upon orthoptics by accident, really. So it wasn't a well-known profession at the time.
No,
That's a
still
long
isn't.
time. I know, yeah, exactly. And people confuse it, don't they? They think, oh, is it like optometry? And that's what my dad, in fact, said to me. He said, oh, you have to do optometry. I said, no, Dad, it's orthoptics.
Does he know what orthoptics is now?
Yes, he certainly does. Although he struggles to say it sometimes. He goes, ortho-optics? I'm like, no, Dad, it's just orthoptics. And it's that education, isn't it, of like letting people know what orthoptics is. And I think I spent most of my first year at university doing that, with all my friends saying, well, orthoptics is all about straight eyes. And actually it was at the time, the head of department then, Gail Stevenson, who was just incredible. She was the pioneer in setting up the programme at Liverpool. And she said, well, I describe it sometimes as like physiotherapy for the eyes. And I thought, that's a great way.
It's interesting because somebody's told me that, but only recently.
Oh, really?
And after trying to explain what orthoptics is and not just market, but just explain what I do. And when somebody said that, I was like, oh, I love that. And now when I use that analogy, everybody gets it.
Yeah, they do. Because and it's giving the profession that gravitas of this is about us being the first person that a child might see or an adult. And funny enough, actually, as a youngster, I wanted to work with children, but I've ended up working with older adults.
That's true.
Yeah.
That's true.
Because I do my clinical job at the Royal Liverpool Hospital and they just see adult patients.
Okay.
So we see quite a lot of the neuro patients and thyroid patients who just come through the hospital. But I'm now based at the University of Liverpool, so I'm the professional lead for orthoptics. So my journey's been quite long, really, since starting back in 1992. So I don't know if I should have really given that away.
And did you have a plan to get where you are now, or did it kind of just evolve organically?
I knew that I wanted to always be in education. That's my passion.
Yeah.
I love educating. So after I graduated, I did go into practice and I practiced for a year, and then an opportunity came up at the University of Liverpool. So I had my one eye always open on returning back to a university in some capacity, obviously to do research. And I think that's my passion, is to do research and education. So a friend of mine spotted an advert in the paper that had just been in for the day saying 2 postgraduate opportunities in orthoptics.
Oh, wow.
And we both applied and we both got it.
Oh, fantastic.
And it was incredible. Yes, it was really great.
Fantastic.
So returning back to Liverpool was great for me. I loved the city. So
very nice. And if you reflect on orthoptics, because we were just talking earlier before this about how orthoptics has really changed and it's expanding and whatnot. Would you? What are your thoughts on how orthoptics have changed?
incredibly. so that we were just having that conversation, weren't we?
Yes.
That from when I started the degree programme, and just a little fun fact is I was one of the first cohort to do the degree programme.
Oh, wow.
So the inception of the degree was in 1992 and I graduated
Because
in
before
95.
that it was a diploma.
That's right,
correct?
yeah. So from seeing that, from going from a diploma to a degree programme, and now how it's evolved into this profession that are crossing boundaries and really pushing boundaries to provide services to patients is incredible. The whole ACP, Advanced Clinical Practice,
Yes.
in paediatric ophthalmology, in
Yes.
neuro-ophthalmology, special educational needs is incredible. And it's been so exciting being part of that. And that, so at the moment, I'm professional lead for orthoptics, and seeing those programs and being part of the development of those programs has just been so exciting.
I can hear it in your voice. I could see the passion as well.
It's incredible. And you know, even last year, we've now got an MSc pre-reg orthoptic program that you can do in 2 years. So it's a fast track program for, say, someone who's done a degree in biology
Right.
or anatomy.
But would they have had to work clinically to do that?
No. So they've done their undergraduate program, BSc.
Yes, yes.
And they say, right, you know what? I need something to do vocational.
Yeah.
They can come,
Gives them that vocational
do
option.
this MSc program with us.
Wow.
2 years, they get clinical placement experience, same as they would do as a undergraduate.
Yeah.
And be qualified as an orthoptist 2 years later. So it's a fantastic opportunity for
Really fantastic.
people who have done, you know, as an 18-year-old.
Yes.
Sometimes you don't know what you want
Yes.
to do, and you kind
That
of,
was the trouble I had.
well, it was with me. As I say, I stumbled upon it. It wasn't,
Yeah.
I knew what orthoptics was and applied specifically for that program. It was just one of those like, well, this is what I know I'm interested
Yeah.
in, but what could I do? And I think quite a lot of 18-year-olds perhaps don't necessarily know that
So
and
true.
think, right, I'm going to do a degree in anatomy or
Yeah.
biology.
Yeah.
And then 3 years later, they're like, don't know what job to do with this
Yeah.
now. So they've got that opportunity. So we've got a really nice group of students at the moment who are doing the MSc pre-reg
Have you had
program.
anyone graduate from that yet?
So we will do this time next year.
Okay.
So we have a January intake. So our first one started in January 2024.
Fantastic.
So they'll finish in 2026 and we'll have their
Oh,
graduation.
exciting. I'm going to keep an eye out on
Yeah,
that.
but it's so exciting. And I think that just shows, doesn't it, the need for the orthoptic workforce to grow.
Yes.
Because these programs are being commissioned.
Yes.
And it's an online program. It's a hybrid mode of delivery.
Yes.
So it can be done online and in person.
Oh,
So,
fantastic. That
yeah.
sounds really great. Thank you for sharing your story. Thank you for sharing what's going on now as well and giving us this time. And thank you for being here. I'm going to ask one last question just to wrap up. Where do you see the future of orthoptics in the next 10 years?
10 years, that's a great question. I think what I've seen in the last 5 years, the next 10 years looks incredible. I think there's opportunities for orthoptists to refract and prescribe. And that is where we're at the moment. We need to look at our independent prescribing rights. And I think we're going to be such a pivotal part of the ophthalmic team, working with our ophthalmologists, optometrists, ophthalmic nurses, and really providing a fantastic patient-centred service.
I love the sound of that. Thank you very much for having for being here, Jigs.
Oh,
Thank you.
welcome. Thank you, Fahima. That's brilliant.